Okay, let's discuss about the trial lens parameter choice, which is total diameter. For total diameter, as we have already discussed, that total diameters must be around 2 mm larger than SVID. Yes, that's what the concept is. But what about other things? So the few other things that we must know is in case of soft contact lens. So if soft contact lens is high water content, like literally greater than 60% water content, then we generally do SVID plus 2, and then we extra add 0.5 mm. That's one of the rule. Okay, if water content is higher, then we add a 0.5 mm extra. So definitely, SVID selection, we definitely go through the manufacturer's recommended guideline. That's another point of view. So in many trial lens, we do not have that freedom of selecting a total diameter. We most of the time, 99.99% we have freedom of selection base curve, but very few times we have freedom of selecting total diameter. Many of the times, total diameter is fixed. Yes, and then how to select the total diameter. So increase the total diameter. uh, what do we do? If total diameter, we increase the total diameter, the tightens the lens fit, as we have discussed in the optics section of contact lens. If we increase the total diameter, remaining all factor constant, what happens? Increase societal height. If societal height increases, what happens? Fitting is tighter. And at the same time, we know that if societal height decreases, then what happens? Fitting characteristics is basically what do you know? Basically, it's flatter fit. Yes. So there is a rule of thumb which is very common MCQ. One of the common MCQ. What is the rule of thumb? Is if total diameter of soft contact lens. Just remember, we are talking about soft contact lens. That same rule of thumb will come in RGB, but parameter definitely the number is different. Yes, total diameter increases by 0.5 mm. What happens if 0.5 mm total diameter increase in societal height? But at the same time, we have to decrease the societal height by same amount. So which is equal when BOZR increases, means we flatten the BOZR. So by 0.3 mm. That's rule of thumb. That's really important rule of thumb. Okay. So when we increase the total diameter by 0.5 mm, then we increase BOZR by 0.3 mm in case of soft contact lens. That's a rule of thumb, so that we will have same fitting characteristics. What do we mean by same fitting characteristics? Means roughly same societal height. We can say roughly, yes. So example, for example, the rule of thumb example is, if BOZR is 816 and total diameter is this, then we increase total diameter by 0.5 mm. Yes, then we have to increase BOZR by 0.3. So for 14 mm total diameter, 8.9 BOZR will give same kind of fitting as compared to 13.5 mm total diameter, 8.6 BOZR. Yes, that's a rough idea. Okay, so why that is rough? Because in both conditions, like 13.5 mm and 8.6 BSR, 14 mm and 8.9 BSR, we have both kind of rough original, maintain original ratio societal height to total diameter. Yes, that's the rough idea. Okay. So trial lens parameter choice, central thickness. Obviously, we normally we do not choose central thickness, but definitely central thickness for minus is definitely low, plus is definitely higher. And so normally in categories, yes, for minus lenses, ultra thin means if central thickness is less than 0.06 mm. If it is 0.06 to 1 mm, we call it thin contact lens. And normally standard, which is 0.1 to 0.15 mm. If it's greater than 0.15 mm thickness, we call it thick lens, a little bit thick. Yes. So as it's a very common rule, thicker the lens, more the movement of the lens. Yes, it's simple. Lens thickness moves more than thin lens, means thick lens more moves more than thin lens. Basically, thick lens does greater interaction with the upper lid. That's very common rule, you must understand. So larger the thickness of the contact lens, greater the interaction with the upper lid, and greater the interaction with the upper lid, greater the movement of the contact lens. Okay. Okay, fine. So another point is optic zone diameter. I have already told you front optic zone diameter. Why it's important? It's important because we want our pupil to be covered by front optic zone diameter, no matter what it's photopic or scotopic. Yes, definitely we want to our scotopic pupil covered by front optic zone diameter. So usually front optic zone diameter is 8 to 11 mm. For high RX, definitely with a higher RX, front optic zone diameter gets smaller. It must be smaller, otherwise lens edge thickness in minus lens and central thickness in plus lens goes way beyond what we want. So must take pupil size in photopic or scotopic condition, but definitely for scotopic condition we want our pupil to be covered by front optic zone diameter. So for lower RX, definitely front optic zone diameter is larger. For higher RX, it goes smaller. So that's why with a higher RX we must be cautious. In case of higher RX, if there is uh, pupil is covered completely by FOJT at scotopic condition or not. So effect is smaller, more flexible periphery, so less movement and greater lens distortion is possible. With larger FOZD, less flexibility of periphery and more movement and less lens distortion is possible. So these are a few things that actually uh, it's same as uh, uh, increasing total diameter. So what about the water content? Higher power, higher water content for definitely. We want decay by T higher, and definitely high in hydrogel contact lens, making high water content is only possibility, but not in case of silicon hydrogel. So lower the power, low water content for easier handling. Obviously, we know that yes, higher the water content, handling is difficult because higher water content is more malleable, but lower water content handling easier because lower the water content, modulus of rigidity is higher. Yes, so definitely more lower the water content, greater the durability. Yes, higher the water content, lesser the durability. Final choice is the comparison between oxygen transmissibility, handling, and durability. There are definitely it's like sweet balance between all the conditions and patient's history. So what the effect of water content? The increased water content decreases the lens movement because the more water content contact lens, more malleable it is, and more malleable it is, more that contact lens wrapped over to the cornea. Yes, it's like stick to the cornea. So a little bit rigid, better, like silicon hydrogel contact lens. So lens rigidity, at least with thinner lens, spin cast model, and high water contents. So its rigidity is always least with. Least means the minimum. With thinner the contact lens, rigidity is least. In case of manufacturer, it's always spin cast manufacturer. It's least rigidity. It's MCQ question also. Yes, and I have seen many MCQs in which ask which of the following manufacturing techniques will give you the least rigid contact lens, then definitely choose spin cast manufacturing. So higher the water content, lesser the rigidity of the contact lens. It means more malleable that material is. Yes. Okay, let's move further. So fitting assessment, we are now moving into the fitting assessment. Okay, so first and foremost fitting assessment is centration. It's very important. So one is centration, another is coverage. It's always student get confused in this particular point. Okay, centration means, see, it's very important. Centration means superimpose of center of the cornea to the center of contact lens. It's very important. Centration means superimpose of center of the cornea to the center of the contact lens. Coverage means covering of the contact lens to whole cornea. So that's why decenter contact lens can cover fully. It's very important. Yes. So that's why centration, we do not seek like absolute centration. We always want, yes, centered, but not like absolute centered. Cornea center at the center of the lens. That's ideal condition. It's like never happened. Yes, it happened. Yes, that's great, but it's like really difficult to have. So the amount of overlap uh, is normal. Basically means here 1 mm, here 1 mm, here 1 mm, here 1 mm, for example. So corneal coverage maintain all the positions. So for optimal fit it's centered, stiff fit definitely centered, flat fit it's always decentered, because in flat fit lens move away from the cornea. Flat fit you will see decentration, but for optimal fit a small amount of decentration is okay. So fitting assessment, trial fit, insert the suitable lens. Definitely first we will figure it out which contact lens is better, then we insert the contact lens. Assess the lens after is tablet period. Definitely 5 to 10 minutes is very good. Yes, for adaptation period, and further after 3 to 4 hours if necessary, but that's not necessary many times. Assess the centration first. Definitely we can assess the centration, position and movement on blink of the eye, lower lid push-up test. Definitely in primary gaze, age condition, if contact lens age is indent or not. So observe decentration or lag is another important point. So primary gaze, which is roughly 0.2 to 0.75 is acceptable. Op gaze, lag is up to 1.5 mm is acceptable, and lateral gaze lag is up to 1.5 mm is acceptable. But one of the most important tests in soft contact lens fitting is always, like you see centration, then lower lid push-up test is most important, I think. So centration means this. Yes, if your cornea's coordinate is this, then the contact lens see. So in centration there is two system that in exam it's literally came. Yes, one is Cartesian system like x and y coordinate, one is binasal system. So in case of Cartesian system, which is very simple, you will uh, do according to Cartesian system. Like means for this contact lens, see, decentration is x is 0. Basically, there is no movement in x-axis. Y-axis is minus. Very simple. For this contact lens, see, and we have read in mathematics like it's plus plus coordinate, it's plus minus coordinate, it's minus minus coordinate. Yeah, it's minus plus coordinate. That's what Cartesian system is basically. But in case of binasal system, it's a little bit different. Binasal system, whenever decentration towards the nasal side, x is plus. Whenever decentration towards the temporal side, x is minus. That's simple. Why? Always same. If upward plus, if downward minus. That's the difference. If binasal system, we have to think only for x. If contact lens descended towards the nose or nasally, for this example, it's written x is a plus. We do not think like a Cartesian system. If contact lens move towards away from the nose towards the temporal, for this example, x is in negative. That's the difference between Cartesian system and the binary system. Just remember this thing. Okay, so let's move further. Fitting is coverage. I have already told you coverage means simple, if covered or not. But remember, centration means the difference in cornea center and contact lens center are aligned, then it's centered. Coverage means a little bit wide thing. Coverage whether cornea is covered or not. So about 1 mm symmetrical overlap is ideal. Basically means, what do you mean by that? If this is cornea, contact lens, definitely let's take in blue. So let's take a blue. If cornea is centered, then everywhere from temporal, everywhere 1 mm is covered. Yes, that's what, everywhere 1 mm is covered. That's what it means. So ideal coverage is important for shape regularity, prevent trauma to the cornea, limbus cornea, and prevent exposure or desiccation, and prevents tear film disturbance. But it's not ideally everywhere 1 mm. That's not ideal. Yes, coverage sometimes, coverage is important, but full coverage is important, but centration is not important. Yes, a little bit decentered contact lens can be fully covered. It's very important. Okay, so optimal coverage is complete cover, stiff fit, a decenter or poor recovery, because once covered, coverage is full, when you blink, then stiff contact lens is there. Flat contact lens is always often right low. Flat contact lens is always often right low. Flat contact lens coverage is not good. Yes. So movement, another important point. So movement, vertical movement is required definitely. because because of movement remove the debris of below the contact lens and promote tear actions. But in case of soft contact lens, it's very very weak. Epithelial wetting by the mucinous spread is also dependent upon the movement. So so movement depends on the lens type, lens design, lens material, fitting relationship, major important lead factor, and topography. What are the rough idea? Optimal fit movement is roughly 0.3 to 0.5 mm. Stiff fit means it's less than 0.2 mm movement while blinking, and stiff fit means while blinking movement is greater than 1 mm. It's like flat fit. Yes. So, and now what is lag? Lag is referred to the resistance of lens movement with the eye if any gaze from the primary. So from primary, if your eyes move towards up gaze, where contact lens remains in the primary gaze. For example, contact lens do not move with your eyes. That's lag. Yes. So lens centration is noted with eye looking up gaze while patient is instructed to move. In this picture, can you see? Patient look at the primary gaze, then patient moves up his eye, but contact lens remain at the same place. Contact lens do not move with the eye. We want our contact lens move with the eye, so that there's very very less lag. But see here, lag so much. Yes, that's not good. And we want for optimal fit, stiff fit and flat fit. Optimal fit for up gaze and temporal gaze, lag is around 1.5 mm is good, or less than 1.5 mm is good. Stiff fit means lag is very low, okay, or none sometimes. Flat fit is greater than 2. Yes, lag if you from primary to up gaze or from primary to lateral gaze. Push up test, I think one of the most important test of all tests. We have, if we have to distinguish between if contact lens is stiff fit, um, flat fit, or optimal fit. Definitely flat fit you can recognize from the very first moment of fitting. It's difficult for the patient, it's moving, its movement is high, but difference between optimal fit and stiff fit is difficult. And that's where push-up test come, especially lower lid push-up test. Yes, this lens is pushed towards uh, upward with the help of lower lid, and then recovery is observed. What we observe? We observe recovery. What do? We do push the lower lens edge with a lower lid. Okay. Then what we observe is, in optimal fit we observe quick recovery, but in stiff fit we observe slow recovery. That's very important. For flat fit it's like quickest. Flat fit it recovers quick. For optimal fit, yes, it's quick, but you can sense that. But in stiff fit, recovery is literally slow or nil recovery. So that's why you distinguish between optimum and stiff fitting. I think you will never ever find any difficulty distinguishing optimal fit, stiff fit with flat fit. Flat fit is like literally very clear. You will see in your practice. But optimal fit and stiff fit, you have to distinguish between two, whether it's optimal fitting fit or whether it's stiff fit. At that particular point, push-up test work like magic. Push-up test, I think, one of the best tests in soft contact lens. Yes. So comfort, definitely flat fit. You don't worry about flat fit. Flat fit directly poor, finished. Flat fit from very initial time, it will patient feel discomfort, and they will take like much longer time for adaptation. But stiff fit and optimal fit, initially they are both good, but stiff fit will take time. And stiff, if you fit stiffly, they will fit discomfort in long term, like long term literally after hours. So that's why it's very confusing, stiff fit and flat optimal fit for initial. Flat fit is like easiest. Okay, fine. Edge, even flat fit edge is faulting, even it's pop out a little bit. If it is flattish, then it cannot be uh, in the eye, it will pop out directly if it's too flat. But flat fit is difficult. Flat fit moves with eye, it's difficult for the patient, and it's difficult for adaptation, everything. But definitely optimal fit in stiff fit. For edge, optimal fit there is no indentation, but stiff fit there is indentation. But indentation you cannot see in 2 minutes. Yes, it will take time to see indentation. So it's very, very important that you'll do lower leg push-up test and distinguish whether it's stiff fitting or optimal fitting. Flat fit is easy peasy. Modifications. So optimal fit, definitely that's what we want. No modification. Stiff fit. If it is a stiff fit, that what we want to do. We want to increase BOZR, or definitely we want to decrease total diameter. Decreasing total diameter is not like easy option, but definitely increasing BOZR. What do you mean by increasing BOZR? Flattering the base curve. If it's flat fitting, definitely this is a good option to make BOZR smaller, to make BOZR base curve steeper, which is a better option. Then we will do overrefraction. Overrefraction is very simple. So at overrefraction, then what the power of the trial lens on the eye is -3, for example. If there is overrefraction of 0.5, what we will do? We'll add. I think in this particular case, we don't have that overrefraction like literally +4 or -4. If that condition, then we have to do vortex correction. It's generally this condition came in scleral lens. Yes, scleral lens patients. So what is not acceptable? That's very important point. What is acceptable? That's easy. But what is not acceptable? If lens or edge is curling or winkling, it's very important. That's to lose contact lens. You have to. If congenital indentation too tight, just remember congenital indentation you cannot see in 2 minutes, 3 minutes. It will take time because it's tight lens feature. Yes, excessive decentration. It's very easy. Flat fitting. Excessive movement, very easy, flat fitting features. No movement, even push up test is okay. If there is no movement, remember it's not good. So corneal exposure under circumstances, that's not good. Coverage is not good. We don't have to accept that. For fits producing limbal or perilimbal scoffing, and that's not good. Fits which results in blink related visual disturbance, definitely that's not good. We don't want that patient can see better when he's blinking, or patient see worse when he's blinking. That's not good. Blink related visual disturbance is not at all good, not acceptable. So indications for excessive tightness, I have already told you. Let's once lens immobile, that's very important. Even when lower lid push up manipulate attempted, that's worse. Yes, if you do lower lid push up, then lens is still immobile, that's like worse. Congenital indentation at lens edge, that's very important, but remember you will not see that immediately. So after some time blood flow restriction, and then what happens, that perilimbal vessels under the lens periphery, it's like red lens across the lens edge, but exactly at lens edge it's like white. Yes, because of the indentation by the lens edge, definitely because of indentation and uh, constriction of perilimbal blood vessels, there is a low grade inflammation. So it's always, in case of steep, vision is better immediately after blinking. In case of flat fitting, vision is better when not blinking, when you stare continuously, something like that. On eye dehydration tend to tighten the fit, so that's why in case of um, high water content contact lens, we select a little bit larger and a little bit flatter contact lens. Yes, because if there is on eye dehydration, contact lens tend to be little bit tighter. So indication of excessive loss, it's very easy, like it's literally easy. First, if it's extreme, lens will not stay in the eye. Second, excessive movements. Third, weakening and buckling of lens is, so definitely vision is variable worse immediately after blinking. So better immediately after blinking in tight lens, worse immediately after blinking in loose lenses. So inferior lag, which is very simple to notice, lens may slip off the cornea in off gaze, so which is very important. Subjective discomfort due to the lens mobility, which is very common. It's only feature of flat fitting in, for, at least for initial 1 hour. Yes, in stiff fitting or optimal fitting is comfortable initially. So trial fitting final order, what are the things that we want? We want lens parameter, which is centrally important, lens material and type, specific requirement, delivery date required. So lens dispensing, provide information to care regimes. We will definitely going to talk in next videos. Practice insertion removal technique, that's central important. Dispensing is very important in contact lens. Provide information on adaptation, definitely. Provide information on sign of complications. Aftercare visit schedule, which is another important thing that you will do if you want to reduce your complication rate as an optometrist. So aftercare, definitely investigate complaints, perform general ocular examinations like over refraction, slit line microscopy, other particular to the patients, assess lens fit, definitely review lens care regime, schedule then aftercare visit. Yes, next aftercare visit. So I think that's it. Now I'm going through a few table to summarize all these things, and I think let's see what how it goes. Yes. So we are talking about issues, cause, and remedy. What are the in soft contact lens? Yes. If the issue is comfort, what can be the cause? Definitely foreign body, thicker lens with more interaction with upper lid, looser lens. That's really simple. Looser the lens, more discomfort is there. So edge standoff, this is also one of the feature of too loose lens. Discomfort and blinking is definitely if surface deposit or any other things. Foreign body, definitely remove cleaner range, and too thick lens, refit with thinner lens. Loose lens, definitely make it tighter. So edge standoff, or definitely think about the parameter and all these things, because edge standoff many times it's like simply too loose lens. So change lens design. Discomfort on blinking, so steepens the BOZR because loose lens has always more interaction with the upper lid, and the lower the modulus of elasticity. What are the problem in the vision? Incorrect power, incorrect astigmatism, loose lens, steep lens, so variable over refraction. According to them, do this kind of vision correction. Centration, lenses is too large, make it smaller. If lens is too smaller, make it larger. Obviously, whenever you talk about centration and lens is too flat, what do? You steepen the BOZR so that flat lens becomes tight lens, so that it's optimal tight. Yes, as alignment modulus is too high, then definitely use lower modulus lens. Lens too flat, obviously you will stiffen the BOZR. Lens too tight, loosen the fit. How will do the loosen the fit? Reduce the BOZ, reduce the total diameter, or increase the BOZR. Yes, movement on blinking. If it's too tight, lose the fit. If it's too loose, tight the fit. Approximately loose fitting, there is guideline to guideline, but yes, 0.5 greater than 0.5. Many easy guideline is greater than 1. So excessive tearing, definitely you have to check about the foreign body, or lenses is split or lenses way scratched. That's very important point. Push up test, that's I think one of the favorite test. If it is tight lens, lose the fit, loose lens, tight the fit, and all these things. Okay. So what are the summaries? And I will definitely going to discuss a few more tables. Summary is, what do you do? Measurement, keratometry as well is more important. Base curve and diameter power, select the lens type, assess fitting of the lens settles on the eye. Definitely, what do we do? Fitting. We would think about coverage, centration, movement, comfort, push-up test, lag, and all these things. Assess the vision. Definitely, over refraction is one of the major part of what do we do, and vision, and not tight on the eye. So this again came from the same paper. So what are the things that are important? Comfort must be greater than 7, subjective out of 10. So continuous discomfort works on the blinking variables for norms. Possible cause, there are a lot of cause you can see. Yes. So vision must be ideal. What should be the vision? Crisp, clear, stable vision, and what can be variable from the norms. These are the things. Okay. So you have to understand centration, full corneal coverage, 1 to 2 overlap, and centration must be always, centration must be there in all position of gaze. Yes. What must be the edge alignment? It's regular alignment with the conjunctiva is important. What is the movement? Roughly 0.2 to 0.4 mm movement is always optimum movement. What should be the push-up test result? Smooth recovery from push-up. Yes, we want smooth recovery, not that fast recovery, and not recovery at all. We don't want the null zero recovery. That's another thing. So it's something like that. Just pause the video and see all the chart. Okay, again the same thing. Just pause the video and see what do you mean by each and every test, alignment, comfort, these all things. Again, I'm going to say same thing. Just pause the video and see what I mean by sign and observation, possibility, cause, and management and changes. Yes, I have made all the things clear here. So I want to discuss this last two slides, okay, which is important slide. So what is the additional insights that, not additional, we have already discussed about it, but I want to discuss it with you. The push-up test performance, I already told you one of the best tests is push-up test. So speed, recovery, and ease of displacement is most important. So one of the best predictor of tightness. See, it's very important that you get mastery on the push-up test, especially lower limb push-up test. And you can, so lower limb push-up test we do because we want to distinguish between optimal and the tight fitting, not loose fitting. Loose fitting is very very easy. Okay, I want you to know sagittal height and concept of sagittal height. So internal depth, the vault of the lens relative to eye surface, is increasing recognition is critical. So lens is sufficiently sag will be loose, and excessive sag cause tight. Basically means if sag is sagittal height is greater, it means tight fit. Sagittal height is smaller, insufficient sag means loose fit. That's important. Okay, change the modulus. What happens? So influence how forgiving the lens is. So higher the modulus may exacerbate age problem. It's always there. If some higher the modulus, age problem can be there, and lower the modulus from this issue, but may flex more. What do you mean by may flex more? It will wrap up to the cornea and handling issues also with a lower modulus contact lens. So it is critical to interpret multiple signs together. So it's always there. Like fitting, it's like art, isn't it? You cannot see just movement. You cannot see just indentation. You have to see all these things together. Yes. So it's like everything. Yeah. It's like everything. Always confirm optical performance, because no matter what, at the end of the analysis, contact lens must provide vision. So it's very important you see check visual acuity and over refraction and stability of over refraction through blinking. Yes, so you have to know this all these things in one setup. The lens fit perfectly, gives a blur vision, is not acceptable. Do you want that? Absolutely not. If your lens fit perfectly but it's giving a blur vision, then what is the use of that contact lens? You have to be cautious on optical performance of that particular contact lens. Okay, lens behavior may change over the time, because over time parameter may change over the time. Contact lens may get more scratch, may get more deposits, or parameters may can change. Sometimes the radius of curvature can change, or total diameter can change. Yes, a little bit, but it can change. So over the time there can be changes in lens behavior, so that's why we have to be cautious about it. So we have to take it serious that whenever you put contact lens, do not check immediately. Just wait for 10 to 15 minutes for adaptation time, then we will move towards the um, what do you call it, lens fitting check. That's exactly same for RGPs. We will take like 20 to 30 minutes and then we will move forward. Okay, so I think that's it. I have taken this paper also, and definitely this three books, which is very very great book. I think that's it for now. Pistancius.